Now coming to the new topic, peripheral odontogenic fibroma. What is peripheral odontogenic fibroma? We will discuss. At first, it is a type of odontogenic tumor arising from odontogenic ectomesenchyme with or without odontogenic epithelium. Here see odontogenic tumors. WHO classification 2017, benign and malignant. Under benign, see here tumors arising from the odontogenic mesenchyma. This is the odontogenic fibroma. This is peripheral and central odontogenic fibroma. Peripheral odontogenic fibroma, it is proliferative lesions which is neoplastic and inflammatory occurring in gingiva. Here you see there is a proliferation between the two teeth in the gingiva. See here, this is inflammation. Previously it was termed as peripheral ossifying fibroma. This is the peripheral ossifying fibroma. It is quite different from peripheral ossifying fibroma. Now who consider it as an odontogenic tumor? Now coming to the clinical features of this tumor, it is a rare lesion, no gender predilection, that means no sex स्पेसिफिकेशन, दैट मीन्स मेल में ज़्यादा है फीमेल में ज़्यादा है, ये कुछ भी नहीं है. एज इज 5 to 65 years. Between 5 to 65 years, any of them can be found. In case of jaw, mandible is more predilation than the maxilla. It is a slow growing lesions. It is generally described as a solid, firmly attached gingival mass arising between the teeth, sometimes displacing the teeth. Here you see that solid gingival mass and it is firmly attached. See in the figure, the lesions arise between the teeth. In radiograph, see how the lesions displace the teeth. At the time of surgery, calcified stalk may be found, which is radio-opaque flecks on the radiograph. Flecks means patches. We know that on radiograph, tumor is seen as a radiolucent and the calcified material seen as a radio-opaque. In case of this lesion on radiograph, we found some radio-opaque flecks. These are calcified material or calcified stalk. Coming to the histological part, we know that this is a type of odontogenic tumor which is arising from the odontogenic ectomesenchyma with or without included odontogenic epithelium. Here you see what is the ectomesenchyme. Here the cellular fibrous connective tissue parenchyma. This is connective tissue, that means it is mesenchyma. Now coming to the epithelium part, scanty or numerous non-neoplastic islands, strands, cords of columnar or cubital epithelium. This is epithelium part. So here is a connective tissue plus epithelium. Sometimes there may be vacuolated odontogenic epithelium. Actually, what is the parenchyma tissue? See in the figure. This is the parenchymal connective tissue. See in the histological figure of peripheral odontogenic fibroma. This is the parenchymal connective tissue. There is also cords, strands, islands of columnar or cubital epithelium. There may be vacuolated odontogenic epithelium. Calcified tissue may or may not be present. If present, it resembles like a trabecula of bone or osteodentine or cementum-like material. Here you can see the trabecula of bone. Mature fibrous connective tissue stroma is present, which is highly vascularized. That means in histological fissures we found connective tissue, epithelium, and mesure connective tissue stroma. That is parenchyma, connective tissue, columnar or cuboidal epithelium, and mesure connective tissue stroma. Okay. Vacuolated odontogenic epithelium may be present or not be, and calcified tissue may or may not be present. Treatment: surgical excision.